I am Dr. Sudhakar Reddy Tirupthi, boasting a 30-year tenure in modern medicine with a specialization in pediatrics, alongside 15 years in homeopathy, a domain I regard as spiritual medicine due to my profound understanding of it. Rather than being pigeonholed as merely a child specialist, I am more inclined towards the designation of a holistic specialist. My methodology in health and wellness is all-encompassing, aiming to treat the individual as a whole, rather than merely addressing symptoms. This approach allows me to treat multiple ailments with a single, nature-indicated medicine, as opposed to the conventional practice of prescribing multiple medications for a single condition. This philosophy is the cornerstone of my YouTube channel, Try Incurable. Here, you'll find unique and insightful content on health topics that transcend conventional approaches, offering a treasure trove of valuable information that can significantly impact your life. If you're ready to embrace a holistic perspective on health, I encourage you to subscribe to my channel and share it with others. Together, we can spread the word and help people discover a new path to well-being. Thank you for your time and interest in my holistic health perspective. I truly appreciate it.
The monthly ordeal that many women endure is often poorly understood, overlooked, and inadequately addressed. The phrase menstrual cramps is itself an understatement, belittling the severity of the discomfort experienced. This lack of awareness and concern is prevalent not only among women themselves but also among healthcare professionals. Consequently, numerous women refrain from seeking medical advice, and those who do are frequently met with insufficient treatment options, usually limited to analgesics. This creates a pervasive belief that their condition is incurable. Based on my observations, approximately 1/3 of women do not seek medical attention, another third seek help but fail to find complete relief, and for the final third, pursuing treatment seems useless. The traditional healthcare system often falls short in offering effective relief for many severe cases, with some doctors conveying misleading messages such as, 1. This is a common issue among all women, it's nothing serious. Just take this analgesic, use a hot pad, and it will subside. 2. Your complaints stem from mental weakness. 3. The pain is merely a figment of your imagination. 4. You are experiencing these pains because you are nearing menopause. 5. The pain is because of weakness. 6. Giddiness because of low blood pressure. These dismissive attitudes not only undermine the severity of the condition but also contribute to the ongoing neglect and misunderstanding of women's health issues. The distinction between primary and secondary dysmenorrhea proved to be of limited utility in guiding treatment approaches, as my methods, which focus on the individual constitution of each woman, consistently succeeded in alleviating menstrual pain. The term perimenstrual syndrome is similarly misleading. Issues labeled as such often arise from incomplete diagnoses. However, when the diagnosis thoroughly addresses the root cause, namely, the patient's constitution, I have never encountered failure in treating the diverse symptoms I am about to discuss in all the examples in this video. Based on my experience, several symptoms profoundly impact a multitude of women, with the top 5 warranting special attention in a descending order of significance. Abdominal pain before, during, and after menstruation ranks as the most critical issue. In the second part of this topic, the next video will specifically address the diverse experiences of menstrual discomfort shared by individuals from my practice. Mental symptoms, equally pivotal as abdominal pain, considerably disrupt women's lives. Back pain, breast tenderness, heaviness, and pain. Pain in the legs. Together, these symptoms significantly contribute to the overall discomfort experienced by many women, necessitating a detailed exploration of their effects and the exploration of management strategies. Common mental symptoms experienced particularly before and during menstrual periods include mood swings, irritability, anger, dullness, depression, crying, and weeping. Rare symptoms reported include memory weakness, fear during menstruation, and indisposed to talk. Interestingly, only one individual reported experiencing a surge of energy and confidence during her period. The symptoms my patients complained about less frequently, listed in descending order of frequency, include the following gastrointestinal symptoms. Diarrhea coincides with menstrual periods. Nausea and vomiting occur before and during menstruation. A sensation of abdominal heaviness before and during periods. Abdominal bloating starting 1 week before menstruation, accompanied by constipation that requires effort to alleviate. An increased appetite before periods. One patient reported suffering from flatulence before menstruation for 7 years. The presence of flatulence during periods. The development of food cravings before menstruation. sharp rectal pain, similar to needle pricks, 1 week before periods, along with a drawing pain in the legs that eases once bleeding begins. Women experiencing dysmenorrhea have described the following types of vaginal discharge: occurrence before, during, after, and between periods, as well as instead of menstruation. Texture and appearance akin to aloe vera gel and curdled milk. Transition to brown coloring towards the end of the menstrual cycle. Acrid and corrosive nature with a resemblance to milk in consistency. Presence of brown, green, and blood-tinged discharge around the time of ovulation. Cream-colored, viscous, and stringy discharge preceding menstrual periods. Manifestation in yellow coloration. White discharge characterized by a foul odor persisting continuously. Individuals experiencing dysmenorrhea, other less common symptoms include chills during menstruation. These can occur before, during, and after the period, affecting various areas such as the chest, head, spine, and the entire body, excluding the head as well as the lower abdomen and perineum. Itching, vaginal itching commencing 2 days before and continuing during menstruation. Postmenstrual vaginal itching, itching in the chest preceding menstruation. Vertigo, experienced before and during menstruation. Weakness, notable before menstruation which improves once bleeding begins. Occurring during and after menstruation. Increased sexual desire, noted before, during, and after menstruation. The following are uncommon and distinctive symptoms experienced by some women, experiencing discomfort, blockage, and pain in the anus during menstruation. Development of blisters on the genitals during menstruation. Irritation of the throat coincides with menstrual cycles. Pain located between the urethra and vagina following urination. Insomnia preceding the menstrual period. Emergence of acne and nodules on the face before and during menstruation. A feeling of downward pressure in the genital area. Formation of ulcers on the tongue and gums. Experiencing a sensation of warmth. Numbness in the legs. A heightened craving for sweets before menstruation. An unusual desire to consume dry rice before menstruation. A burning sensation in the urethra. Burning in the vagina during urination. Experiencing dreams of snakes the day before menstruation begins. Not all women experience menstrual symptoms. The challenges vary from person to person. Experiencing severe discomfort may signal a plea for help from your reproductive system, rather than just a need for pain relief. Some individuals may discover that treatments recommended by their physicians fail to provide lasting relief. However, this doesn't imply that conventional medicine offers solutions for every issue. Relying solely on 1 or 2 painkillers to alleviate menstrual discomfort might appear innocuous, but it's crucial to consider the potential side effects of analgesics. Regular intake can lead to cumulative damage to your liver and kidneys, increase the risk of heart problems, may raise blood pressure, upset your stomach, and possibly cause ulcers. The long-term health implications should not be underestimated. Although mefenamic acid, a constituent of meftal might seem to miraculously ease pain, its widespread use comes with significant risks. Studies have indicated that it can harm the kidneys by elevating urea and creatinine levels. Moreover, regulatory bodies such as the Drug Regulatory Department have imposed restrictions on its use due to these risks, and the Indian Pharmacopoeia Commission has issued a drug safety warning about mefenamic acid triggering DRESS syndrome, a serious skin reaction.
Now, before you think of popping a Meftal during your cramps, do so only after your doctor knows about it. Now, the Indian Pharmacopoeia Commission has in fact issued a drug safety alert about this painkiller. According to them, this painkiller in fact triggers the DRESS syndrome.
It is a medicine that is popped indiscriminately. It would be difficult to find any woman who has not used it. It is available over the counter like many other drugs and bought easily. The indiscriminate use of this drug, Meftal, which is extremely popular, particularly among women who are on their period. It's available over the counter and is being sold and consumed indiscriminately. It's a non-steroidal anti-inflammatory from the NSAID category, but the government says do not use it the way you have been using it. Indiscriminate use can't be allowed. The side effects and the adverse reactions associated with this drug, which is often in fact seen up to 8 weeks after using this pill is that there can be stomach ulcers, there can be bleeding in the stomach, there can be DRESS syndrome, which is in fact rashes that can be seen. And that's the reason why, because of the manner in which this affects many women and the internal organs of women and others who've been consuming it, given that this is a painkiller, the government has issued an advisory with its use and with the way it should be sold.
किसी भी दवाई की तरह मेफेनेमिक एसिड और डाइसाइक्लोमिन जो मेफ्टल स्पास के कंटेंट्स हैं उससे एडवर्स रिएक्शन हो सकती है और ये ड्रेस सिंड्रोम जिसमें स्किन एलर्जी रैश इओसिनोफिलिया कभी कभार ओकेजनली लंग्स लिवर और हार्ट की इन्वॉल्वमेंट होती है.
The Indian Pharmacopoeia Commission has issued a drug safety alert saying that consumers and healthcare professionals are advised to closely monitor the possibility of adverse drug reaction associated with this.
In a world where the stories of menstrual struggles often remain hidden, we uncover the untold, the unheard, and the unbelievable. This is not just about the pain, it's about resilience. It's about the countless girls and women who face these challenges in silence, whose stories go unnoticed by many in the medical community. But there's hope, and it lies in understanding that one-size-fits-all solutions are not the answer. Every woman is unique, and so should be the approach to their healing. Through tailored remedies that respect the individual constitution of each woman, relief isn't just a possibility, it's a promise. Behind every story we share, there's a lesson in empathy, a call for a deeper understanding, and a reminder that gentle healing is within reach. We invite you to join us on this journey. Subscribe to the Try Incurable channel for part 2 of our series, where we delve deeper into these stories of resilience and the paths to personalized healing. And remember, if you or someone you know is struggling, consulting a health professional knowledgeable about individualized approaches can be the first step towards turning pain into power. Together, let's embark on a journey toward comprehension, empathy, and gentle healing. Your story is important. Your healing matters.